Welcome to Public Health Matters, where we talk about what matters in public health. I'm Jane Goodman, Public Health Strategist with the Division of Public Health and Community Services. And before we introduce our guest, I'd like to give you a brief COVID update. Our community levels are luckily at low right now. So we are green in the southern part of the state, but we do have some yellow medium transmission in the very northern part of the state. So while we are having a temporary reprieve, I would remind people to still get tested if you have symptoms, to wear a mask if you're in a crowded indoor space. And then if you are indoors and you don't know the people real well, you don't need to be on top of them. Just 6 feet apart is great. Here's a little bit of more information on the community levels. You can see that we have almost 80% of the country is at a low transmission rate. Our medium rate has gone up to about 18.3%. So again, we're not out of the woods, folks, and we have flu and RSV following closely behind. So just take good care of yourselves and wash your hands well, wear those masks when appropriate. There is a bivalent booster available. Protect against Omicron and the original strain of COVID-19. And it is recommended that you have a booster 3 months after infection or 2 months after your last booster dose. And finally, I want to push this out as we get ready for the winter. The state has created a program for telehealth and Paxlovid. Paxlovid is the antiviral for COVID-19. So if you are unable to get to your primary care doctor or practitioner, you can call 1-800-818-5803, and you can get a telehealth consultation and get prescribed Paxlovid that day. Very important as we enter into these winter months, and transmission is predicted to go up. So keep that in mind. And it is also that season for flu, so crush that flu bug, get that vaccine, get rid of that funny looking guy in the corner there. A yearly vaccine is the most important step you can take to protect against flu viruses. And I got to tell you, folks, it's already going around. So we want to take that seriously this year. And now, for the more exciting part of the show, I'd like to welcome my guest, Wendy Leblanc. Welcome.
Thank you. Thanks for having me.
Wendy is the Director of HIV Services at Harbor Care.
Right.
And we invited you on today, one, because this is such an important topic, and as we get out of this kind of COVID daily beating, we got to remember what we were working on before,
right,
and how important it is to public health and to the public's health to remember that there are a lot of chronic diseases out there, viruses that are still out there, and even if they weren't in the front headlines of the news, we still need to manage them. So, Wendy, you're at Harbor Care, so tell me a little bit about the agency first, and then I want to know what you do there.
Sure. So Harbor Care is a very large organization that serves Greater Nashua with a variety of challenges for our most vulnerable community members, from housing solutions for many vulnerable populations to our federally qualified healthcare for the homeless program that provides primary medical care, dental care, behavioral health services, substance use disorder treatment services, medication-assisted treatment, and a variety of other services and programs, including HIV services.
Wow. So it is a huge agency and does such amazing work in the Nashua community and reaches out into the Greater Nashua region. And so we're so appreciative of Harbor Care. What it's really done for homelessness, I think, in the city as well, because I remember hearing an interview a few years ago about, being able to reach almost zero, now we're back to creeping up again. But a lot of that was due to the work of Harbor Care and housing those veterans that may have had behavioral health issues, or substance misuse issues, and able to give them a home and get them the services they need.
Right, and we actually have some specific housing for people living with HIV called HOPWA, Housing Opportunities for Persons with HIV and AIDS. We have grants through the city of Nashua, through HUD, and through Harbor Care, and that provides long-term housing solutions for people living with HIV. And in the past 10 or more years, when we have our annual point-in-time homeless count, we've been able to successfully document that no persons living with HIV are in unsheltered homelessness in Greater Nashua for at least the last decade. So
Wow,
we're pretty
which
proud
is
of
really
that.
amazing
Yeah.
and so important when you need medical care. You don't need to have, in addition to that, to be out on the streets and in the
Exactly.
cold and in the elements. We invited you today because early this month is World AIDS Day, and it made us think of Harbor Care and the work in the HIV care services. And obviously there's a difference between HIV and AIDS, subtle though it may be. Let's kind of explain it to everyone maybe a little bit about the difference.
Sure.
because-
So HIV is a virus, the virus that a person can acquire through unprotected sex or for sharing needles, and that's the virus. And once the virus is active in your body and you're not taking medications to treat that, and back in the early days, in the late 80s and early 90s, before we had medication to treat HIV, once the HIV virus attacks the immune system to a point that it can no longer fight off other illnesses, then that becomes an AIDS diagnosis.
Okay.
So AIDS is a syndrome that comes from the HIV virus that attacks the immune system.
Okay, so it's so you're working with HIV services because we want to keep people from having that full-blown AIDS.
Correct. So things have changed, terminology has changed. Now we just talk about HIV/AIDS as one condition.
Okay.
And whether or not somebody's health at one point had them at a medical marker that said that their immune system was compromised and they had an AIDS diagnosis, they may very well be living nice, healthy lives now because they're on medication that's treating them.
So let's back up then, because there wasn't always medication.
Right.
And you and I were talking about this before we came on, and that, you know, the 80s were a really scary time
Yes.
for a large portion of our community.
Right.
Because we didn't know there was this strange disease. And we were also talking about, you know, it was a pandemic, it was worldwide. There was very limited understanding of why this disease was killing people.
Right.
And we've had the luxury of time, even though we didn't really have a luxury. That's probably not, luxury is probably a bad thing to say, especially for those who have lost their lives
Right.
to this. But that research and that study and that understanding, we're saying, you know, I recall the first case of AIDS in the mid-'80s, or?
Yeah, I think that's about right. I personally got involved in the HIV community in 1991 when my best friend was diagnosed. And at the time, I was looking for services in the Nashua community. And the only thing that was available at that time was a support group at the basement of the Southern New Hampshire Medical Center. And that support group was actually spearheaded by the nurses at Nashua Public Health because they were starting to do HIV testing. They were providing positive test results, and they had nothing to offer people. So they started a support group, and that was for people living with HIV and people impacted by HIV, someone like myself, a caregiver. And so I got involved in that, and then as the years went by, the services grew, and it grew into the Southern New Hampshire HIV/AIDS Task Force, where I was fortunate to volunteer and become employed in the late 90s, and we've continued to build and grow and do our work until we merged with Harbor Care a couple of years ago.
So you've been doing this a long
Yeah, I have, and we certainly have seen a lot of changes. We were talking about that in the 80s and in the early 90s. There was very limited treatment available. In 1995, they discovered a new class of treatments called protease inhibitors, and that was sort of the shift in people dying of AIDS and people living with AIDS. And so after 1995, that's when we started the drug cocktails, they used to call them, when people would have to take multiple pills every day, and we would do teaching events, and we'd have pill boxes that were overflowing with medication. Fast forward now to 2022, most people living with HIV take one pill once a day.
That's amazing.
It is amazing.
That's like my blood pressure medication.
Exactly. And HIV is truly now a chronic manageable illness as opposed to a terminal one, as it was 20 or 30 years ago.
Wow, that's incredible. And also the expense of those drugs. when they're experimental and they're being developed, as we know that.
Even now when they're on the market, they're still very expensive.
Yeah.
So fortunately, there's federal funding through the Ryan White Act that goes to every state in our country that provides funding for low-income people living with HIV who are uninsured or underinsured. And our agency is actually contracted with the state of New Hampshire to get people enrolled in that program so that they can have their medication and their medical care without any out-of-pocket costs. Because we know that HIV is still a communicable disease.
Right.
And even though people can live with it and live healthy lives, it's still not something that you want to avoid this if you
Right.
can, certainly.
Right.
But it is a very, very different disease than it was 30, 40 years ago.
Yeah, so let's step back then, avoiding HIV. What are some of the, we know that, let's start with who's most at risk for contracting HIV.
Well, in the state of New Hampshire, men who have sex with other men is the highest exposure category for acquiring HIV, followed by heterosexual contact and then injecting drug use. But what's really wonderful is that we can prevent HIV now. And we've always known that condoms prevent HIV by having safer sex. And now we also have medications that people can take. One is called PEP, which is post-exposure prophylaxis. If you and I were to have a sexual encounter this afternoon without protection, and then you disclose to me that you're living with HIV and you're not on medication, I can go to the emergency room and I can get a prescription that I will take for 28 days, and that will keep me from having HIV enter my bloodstream as long as I do that within 72 hours of my potential exposure. And then now we have PrEP, which is pre-exposure prophylaxis. And this is medication that a person makes a commitment to take every day. And then if they were to have unprotected sex with somebody who was HIV positive and not virally suppressed, PrEP would keep them from acquiring HIV. So this is a great medication for people who are either in a monogamous relationship with someone who is HIV positive, or if they're not in a monogamous relationship and they're having lots of encounters in their life that they want to still stay safe, they can take PrEP and they can avoid acquiring HIV that way too.
All right, so you did mention condoms though.
Yes.
So first line of protection.
Condoms.
Condoms.
Yes.
And those, yeah.
What's the other really important message for the whole world to know, and I know if you're not in the HIV community every day like I am, you wouldn't necessarily have awareness of this, but several years ago, after many studies, we now know that a person who takes their medication every day and is therefore virally suppressed cannot transmit the virus to their sexual partners. So if I have HIV and I'm taking my medicine every day and I get my blood checked every 3 to 6 months as my doctor suggests, and it continually says that my virus is suppressed, it's not damaging my body, and it's making me unable to transmit the virus to others. So when we talk about care as prevention, meaning a person with HIV, when they're connected to care, seeing a doctor, taking their medicine, that is prevention because they're no longer infectious. So I truly believe that's how we're going to end this epidemic, is by making sure everybody who is HIV positive knows that about themselves and they're taking medication to keep themselves virally suppressed.
So if they're taking the medication, I'm just trying to rewind. I had this perfect question and now I don't. That happens. So that's one thing that I think is so important, and we talked about, and this is a reminder, is that whole stigma around HIV and AIDS, and how we can avoid that, or how do we reduce that?
Yeah, I mean, that's really the biggest question, and I would say the biggest barrier that people living with HIV/AIDS still face in our community. You know, we do needs assessment and client surveys on a pretty regular basis, and stigma is one of the biggest barriers that people face because they're afraid that people are going to judge them or treat them differently because they're living with HIV. Remember that HIV stands for human immunodeficiency virus. The first word in that is human, and that means that we're all susceptible to acquiring this virus. And for anybody, I mean, I think there are very few and far between of us who have never had unprotected sex. To acknowledge that we all could acquire HIV, or in our past may have acquired HIV, and we were lucky if we didn't. It's no different than any other chronic disease.
Right.
People like to associate the behaviors or the risk factors that people have HIV, like, well, if you didn't have sex with another man, or if you didn't share needles, who cares?
Right.
We're all still individuals, we're humans, and we want to all live the best life that we can. So why does it matter how somebody got HIV?
Right.
It matters that they have it. We want to treat them respectfully. We want to give them medication and care and let them live their lives.
Absolutely. So now I remembered my question.
Okay.
So you had mentioned PrEP and getting your blood tested.
Yes.
So that is part of taking that PrEP, I guess PrEP, even if you have HIV, you're taking an antiviral.
Correct.
So that's not PrEP, but that's if they're taking their antiviral, they do need to, those living with HIV do need to have their blood tested to make sure that it is suppressed.
Correct. It's part of the standard of care for people with HIV that they see their provider every 6 months to a year, depending on how stable they are. And they do measure the virus to see if it's detectable or not. And not detectable or undetectable is what we're looking for. And in fact, the new slogan to remind everybody is U equals U. Undetectable equals untransmittable, meaning if I'm undetectable, my HIV virus is undetectable in my bloodstream, I cannot give it to you. So let's stop being scared of
As
people
in
with
you,
HIV.
the letter
the
U.
letter U equals the letter U.
Okay.
Yes.
That's very interesting.
Yes.
Yeah. And it's really amazing, again, being, now I'm like outing myself on my age, but being in high school and college in the 80s and watching this unfold and seeing some of my peers deal with it and seeing the progress we've made is just really incredible. And that progress comes with time.
Yes.
So like this unknown. And I guess I bring that up to remind people that it's taken a long time.
Right.
Is that 30 years
40
now?
years.
40 years. Oh, I really am getting old.
Almost 40 years.
I guess it is 40 years.
Yes,
That
yes.
sounds like a long time. So I do know you do a lot at Harbor Care. I did pull some of these services off you. One of them is medical case management.
Yes.
So tell us a little bit about what that
Yeah,
entails.
sure. I'll just kind of tell you about our HIV services department. So we have, first of all, it's important to know that the state of New Hampshire has low prevalence and low incidence of HIV, which means that we're not like Boston or New York City or LA. Right now, we know there are just over 1,400 people living with HIV/AIDS in New Hampshire, and about 700 of them are enrolled in services at an HIV/AIDS service organization like ours at Harbor Care, which means half of the people living with HIV in our community are doing just fine. They're going to work, they have insurance, they go to the doctor, they take their meds, they're fine. The people that we serve are people that are dealing with co-occurring disorders like mental illness and substance use disorder, and those who are living in poverty that don't have the capacity to have health insurance, to buy health insurance, to pay co-pays even if they had insurance. And so a case manager is the person's link to the community. Every 6 months, at a minimum, we meet with our client and we do a full assessment where we talk about everything from their housing to their food to their sexual health to their relationships, their support system. And together we develop a service plan based on that assessment of these are the things that I need in order to accomplish what I want to accomplish to live a healthy life. And then we put into place the other services that we have either at Harbor Care or we refer out into the community. So for example, that's program at the state of New Hampshire that I mentioned, our case managers enroll our clients in that every 6 months to make sure they have payment for all of their medical care. We have a peer support program. So we have somebody who provides one-on-one support and runs support groups for people living with HIV, which is great for someone who's newly diagnosed and doesn't really know what to expect.
So important.
Absolutely. And then we have basic services like we have a little food pantry, a little free grocery store. People can come and shop and take whatever they need to supplement their food stamps or their grocery dollars. We have transportation services through a local taxi company or bus tickets for people who don't have Medicaid rides or don't have their own transportation. And then, as I mentioned, we do a lot of work around housing, making sure people have a safe and affordable place to live. And so we serve about approximately about 200 clients throughout the course of a year. We serve about 175 in our Nashua office, and then we have a satellite office in Keene, New Hampshire.
Oh, okay.
That serves about 35 to 40 clients. And our folks, unlike other programs that people may enter, go through a process and then graduate or leave the program, our clients generally stay with us for life, and unless they suddenly become wealthy and they don't meet the income qualifications anymore. But I have clients that I've worked with for over 20 years that I've been at the agency. So we're really a unique support system. And now that we're co-located with the Harbor Care Health and Wellness Center, people can get behavioral health services, dental services, pharmacy, and primary care right in the same location as their HIV services.
So that's really essential because you
Yes.
need it all.
Yes.
I mean, no matter what,
And that's
whether you
the-
have HIV or not,
Yes.
you need all those essential
And that's
services.
what Harbor Care is. It's integrated care for our most vulnerable community members.
And you certainly deal with many vulnerable
Yes.
populations
Yes, we
over
do.
there. So we talked briefly about, before the show, early intervention and prevention, and you said you're not doing some of that at Harbor Care unless the person's a client.
Yeah, so the federally qualified health center is just like any other doctor's office or
Okay.
clinic that you may go to get your medical care. And if you're a patient at the Harbor Care Health and Wellness Center, then certainly you can get HIV testing, STI testing, PrEP and PEP that we've talked about, any of those things that you may need. But we're not an open clinic like Nashua Public Health is, where I will refer people for HIV testing when somebody calls on the phone because they've Googled our name and they say they want to get tested for HIV. If they're not a patient at Harbor Care, then we would refer them to you folks to do the HIV testing.
Now, is it hard for them to become a patient at Harbor Care?
Again,
then?
it's just like, we're always accepting new patients. It's just like getting a new doctor, going
Okay.
to a new doctor's office, and you would have your doctor at Harbor Care, and then you would also receive this other array of services there too.
But can anyone go to Harbor
Yes.
Care? So even, you don't have to be part of your
That's the whole
high-risk
point.
population.
That's correct.
Yeah.
So it's designated by the federal government as a healthcare for the homeless program, meaning that we specialize in the needs of people experiencing homelessness. But it's not all. That's not all we
Right.
serve. Anybody can come and get their health care at Harbor Care.
Right.
Yes.
So it's just, and it's conveniently located
Yes.
right downtown.
Yes, indeed.
Have brought some flyers over there. And thank you for the shout out to Public Health, because we do have a sexual wellness clinic on Thursdays. And if you call ahead, 589-4500, we can get you in for that testing. And we do a lot of STIs as well. So, and that's a great partnership. And it's really nice to know that you're referring to us.
Absolutely.
And then you did mention the peer support groups, which, I give a plug for only because that isolation, you sometimes think you're alone, you have this chronic disease. We do a lot with our community health improvement plan around chronic disease.
Yes.
And like you said, HIV is a chronic disease, so it has to be managed. It's not going to go away, but you have to do the right things for it. And so there's support groups for all sorts of things, whether it's, COPD or
Right.
whatever. So HIV should be no different. And what I like is giving that hope. And I learned something today that, if you are on those antivirals and you are, the virally suppressed, new language, you just live a normal life. You're
That's
not
it.
going to transmit to your partners
Right.
or your partner and that kind of thing. So
Exactly.
there's a lot of hope out
Yes,
there, which
yes.
is really great. And that must be gratifying for you.
Absolutely.
Having started this in 91.
Yeah.
And now,
It's
oh
a
my
whole
gosh.
different world. It's a
Yeah.
completely different world than when I started this work over 30 years
Yeah.
ago. Back in those days, frankly, I was holding the hands of gay men as they were dying and giving them as much dignity and love and compassion as we could. It's absolutely not. I mean, not that I wouldn't still do that. Of course I would.
Of course you would.
But our clients don't die the way that they used to in
Right.
any way. And so we're helping people live with HIV and teaching them the skills to take care of themselves,
Yeah.
which is very, very different. And it's wonderful that
Yeah.
our services have needed to change and come into the future.
Right. It's fantastic,
Yeah.
and it gives people hope, and it
Yes.
just shows us that science is amazing,
Yes.
but also people are amazing, and the support and the agencies that are out there, like Harbor Care and the other federally qualified health centers that are reaching out to different populations and making sure that they have a medical home.
Right.
Because it's really critical.
Yes.
So wow, this has been fantastic. I want to thank you personally for all the work you do.
Thank you. It's my pleasure.
Such an important thing. We don't want to forget all these things. Like I said at the beginning, we've been living COVID in the headlines, but we got to start keeping these other chronic diseases in the headlines as well. So we do recognize World AIDS Day, early December, and this program will probably run all month long, so that's good. And if people do need anything about Harbor Care or want to make a referral, we'll pop that number up on the screen, 603-595-8464.
That's the phone number directly to the HIV services department?
So, yes, that's where I took it from.
Okay.
So, so they can call Harbor Care as well. I don't
Yes.
have that phone number with me, but since we'll give them the number for the HIV
Yes.
services. So, so thank you, Wendy, for coming.
Thank you for having me.
I'm just going to wrap up with a few more public health announcements to remind people that we still have the New Hampshire monkeypox vaccine clinic sites open around the state. So please don't hesitate to get that if you are at risk for contracting monkeypox or have been exposed to someone with monkeypox. And just some reminders to get your blood sugar checked, to know your numbers, and know your diabetes risk. Visit your provider, trying to get people going back to their doctors. And courage is knowing when to ask for help. A lot of things about mental health and behavioral health in the news among our young, our elderly, among everyone. So start with your primary care doctor. Please just ask for help. Not everything is going to be a severe treatment, but if you're feeling anxious, down, stressed, whatever it may be, talk to your doctor. And is your blood pressure over 120/80? Well, if you haven't been to your doctor, you won't know, but they have cuffs all over the city at pharmacies and grocery stores, so make sure you're checking that. And then finally, visit our health clinic. We have immunizations and lead testing on Tuesdays and Fridays, Tuesdays from 4 to 7, Fridays from 9 to noon. And as Wendy gave us a great plug, we have a sexual wellness clinic every Thursday from 3 to 6. You do want to make an appointment, 603-589-4500, and press option 2. And finally, because we talked about it, and prevention is our mission, if you're looking to quit smoking, now's a great time, 1-800-QUIT-NOW. And we thank you all for joining us and learning about HIV and the HIV services that are available in this great city. And we hope to see you next time.